There is still time to ensure that you choose the plan that will cover your prescription medications for the next year and offer you the highest amount of benefits possible. Here to tell us more is Agency Principal Miriam Ramos with Mint Insurance Agency. Welcome to the show, Miriam.
It's so glad to be back. Thank you so much.
I'm glad you're back. We need to continue to remind folks about the Medicare enrollment, and when that time period is over, we need to get them thinking about this very important topic.
Absolutely. It's time, as you mentioned, it's a reminder. The annual enrollment period is still going on. It ends December 7th.
Okay.
So it's time that we refocus. You know, I know we've all been so wrapped up with elections, but we have a very important election, and that's your Medicare election period.
There you go.
December 7th.
Yes. Okay, well, put that on your calendar, folks, and try to get this wrapped up before then so you're not at the finish line wondering what to do.
Exactly.
So we're going to go in depth a little bit more here with Miriam. What are the things to look out for when folks are comparing their plans?
Things to look out for are truly your prescription benefit, right? That's something you don't want to be surprised with. We talked about it on the previous interview, and I know health plans are also sharing with you. They've sent the annual notification of changes. So it's important to not only look at what benefits have changed, but also your prescriptions. Will they be covered? Will your health plan have a deductible on those prescriptions? Or a co-insurance, which is a percentage versus a copay? Those are very important things. We want to make sure that you sit with us and we discuss, and that way you'll have peace of mind and not worry about it, not be surprised when you go pick up your prescriptions come January.
Yeah, and then it's too late and there's nothing that they can do about it, right?
Well, no, if you don't make a change during the annual enrollment period, which once again ends December 7th, then you're subject to the health plan you were presently on during the 2024 year, unless there are any special election periods that may apply to you. And you can always give us a call and we can talk about those things, but this is truly the moment for everybody to come out and shop.
Okay. Okay. So what changes, do you see any changes in the beginning of 2025? Any type of changes that are happening in 2025 in terms of prescriptions or healthcare or insurances?
Absolutely.
I mean, what's happening? We've just had a presidential election. What's changing? How is that influencing? Do we know yet?
Quite frankly, a lot of people do have that misconception, right? And they hold off on making any changes on their Medicare options until after elections. But Medicare benefits have already been set. So for 2025, whatever we sit down today or during this period and talk about are the benefits that you will have for 2025. It is not based on who won elections. It's truly based on what's already been approved by the Center of Medicare and Medicaid Services, based on the health plan you currently have or that you are shopping for.
Right. And you're helping clients shop for the best plan available that's right for them.
Yes.
But what happens if they get themselves into a plan that they just really don't like?
Well, one of the benefits, as we talked about last time, there is this Medicare enrollment period that we're currently on. It ends December 7th. If during this time you make a change, come January 1st through March 31st, if you didn't like the plan you chose, Medicare Advantage-wise, you can still give us a call and we can help you change back to the plan you were previously on, or maybe a plan that you found in the meantime. So you do have that option if you make a change during the annual enrollment period. If you don't make any changes today, by December 7th, then you're stuck on your plan technically, unless there are any special election periods that we can sit down and talk about. But we really encourage you.
That doesn't sound like something that folks should count on.
No,
choose
because
wisely
you just never know.
to begin with. Right.
Exactly.
Yeah. So what is the difference between a Medicare Advantage plan and Medicare Supplement policy.
So your Medicare Advantage plans, first and foremost, right, you must have Medicare Part A and Part B to be able to qualify for a Medicare Advantage plan, which is also known as Medicare Part C. And it includes Medicare Part D for prescription drugs.
Okay.
So Medicare Advantage is technically like a bundle, right? Most of the times, based on the zip code, there is no monthly premium for these plans. Medicare supplements, also known as Medigap policies, right? Some people talk about, can I get on a supplement or a Medigap? Well, these do have qualifications like health underwriting, right? They do have additional premiums that can be quite costly based on gender, zip code, age, whether or not the person, has a history or smoking, and like I said, those health underwriting questions. So if you choose to go with a Medicare supplement option, not only will you pay the Medicare supplements premium, but you must also purchase a prescription drug policy, whether or not you take prescriptions.
Oh my goodness.
And on top of that, you must also pay for your Medicare Part B premium. So, what are the benefits of a Medicare supplement? Technically, it's the freedom of not having networks, of technically not waiting for referrals or authorizations. But that freedom comes with that cost, right?
Right.
That's your Medicare supplement. Medicare Advantage is pretty popular and very commonly known for the fact that you must choose a primary care. These primary care physicians usually belong to a network. Some of the networks here presently are Optum, Regal, Lakeside, Memorial Care. So you must choose a primary care physician. The Medicare Advantage plan more than likely will not have a premium, but you must go to your primary care doctor. Your doctor will then provide you with a referral or an authorization to go visit a specialist in the network. So it's a network-based, right, versus a Medicare supplement where you're paying all these premiums technically allows you to go anywhere and everywhere across the country where Medicare is accepted.
Oh my goodness. So if people have questions throughout the year, the year, as it relates to everything that you've just explained, which quite frankly is completely overwhelming.
I know.
Can they call you and get clarification?
Anytime. We are open Monday through Saturday during this super busy time of the year. We actually even take calls on Sundays. But during the year, yeah, Monday through Saturday, normal business hours, 9 a.m., 6 p.m. And it never hurts. If you have a doubt, if you're wondering if there may be an opportunity or a possibility, just give us a call, right? We can answer your questions, not just for enrollment, which we provide at no extra cost, right? We're independent licensed agents. So our services are to meet with you, your viewer, and talk about the different health plan options they have. They may be on Alignment Health Plan, and they might choose to look at their options with United Healthcare, with SCAN, with Blue Shield. The beauty of contacting us is that we can check and compare for them,
Right.
and really identify the plan that's going to fit best. And once again, it ends December 7th, so please take advantage of it. Our consultations are completely free.
Completely free.
In home, we can gather at the viewer's home, at a local shop, maybe here at the center, or even telephonically, the comfort of their home.
And Miriam, tell me, is there any penalties for someone if they don't make any changes?
No penalties. So if they choose to stay where they're at, perfectly fine. If they're already on a Medicare Advantage, on a supplement, or on a straight prescription drug plan with original Medicare, there will be no penalties. It's just the fact that they won't have that access to make changes come the new year.
And are there new enrollment penalties at all?
So folks that really want to make sure they're aware of enrollments and periods and penalties are those turning 65 soon. They do have, and that's the late enrollment penalty, a 7-month window. So 3 months prior to their 65th birthday, their birth month, and up to 3 months after.
Okay.
This is a 7-month window they have to either choose a Medicare Advantage plan, known as Part C, which includes Part D for prescription drugs, or stay on original Medicare and purchase a prescription drug plan, whether or not they take prescriptions. Or last but not least, if they choose to go with a Medicare supplement, it will have a premium, purchase a prescription drug policy, which will also have a premium, and pay for their Medicare Part B, which also has a premium. So there's many options.
Right.
The penalty only goes if you don't have credible coverage past that 7-month window.
Okay.
So if they're still working and they wish to continue their employer coverage, as long as they have proof, that's fine. And that's a whole different subject. And we can have a whole show on employer coverage.
Well, let's have you back on that.
Sounds great.
Miriam, you've given us a lot of information here. We're going to try to digest it a little bit, and then we're going to have you back on the show.
Thank you
Thank you
so
for
much.
coming.
My pleasure.
You're watching This Day on Village TV. We'll be right back.